relative success. And I think she came away with a couple things that, with the governor's leadership, communication, constant. Governor, I want to tell you that I have an assigned who watches. Now, do you think that deserves a medal or what? Yeah. And anyway, that's how important I think what the governor's doing with the constant communication and with Clay Marsh there, right at his side, giving us the health perspective that's been so important. I briefly want to say, Governor, one of the things that I think is most important in getting our schools reopened is the funding that will come from the next CARES package of $105 billion to help our schools reopen, whether it's sanitation, whether it's shields, whether it's extra staff, whether it's more nurses, whatever our counties need, we need to fund that from the federal level because I know it's going to be a big burden to a lot of our school systems and to you as the governor. I'm disappointed we haven't reached a resolution here. I'm fighting hard to get that compromise, and hopefully it includes a lot of other things, small business help, help for our hospitals, also the continued research for our vaccines and treatments, which is essential, I think, to getting kind of over the hump here. But with that, I'm excited to be here to see how these things really work in person and virtually. So thank you very much.
Thank you so much. I mean, again, we can't thank you enough. And Congressman Mooney.
Well, thank you. It's great to be at the briefing today, and that Dr. Birx and the President are here paying close attention to what we're doing in West Virginia and how we can work together and support each other. So I'm Congressman Alex Mooney, here speaking, represent the 2nd District at Governor Jim Justice's COVID press briefing, which is the first time for me too, seeing him on TV. But thank you, Governor, and your team for your leadership during this important time. We should all be encouraged that West Virginians from across our state are supporting, protecting, and standing by one another during this unprecedented time. In Congress, worked with Shelley Moore Capito. Senator Capito spoke about this earlier as well, the telehealth. We have an opportunity and a need here to expand telehealth across our state. So I've co-sponsored the Emergency COVID Telehealth Response Act, as well as the Telehealth Across Access Lines Act, which begins the process of creating a nationally functioning telehealth system. And I know that's worked well. I've talked to folks in West Virginia who've used that. It's necessary, and it's a good chance to move forward on those type of plans. The CARES Act, through the SBA, issued over $1.7 billion in loans to over 17,365 West Virginia small businesses to keep people employed during this crisis. The other thing that I've talked to now, school's open in just a few weeks. And I hear this from my constituents all the time as I travel the district, and they need to have the chance to have their kids go to school and have the parents make that choice ultimately, as we discussed earlier today. But in-person, available education is important. Again, under Senator Capito's leadership, the U.S. Senate most recent coronavirus relief proposal, the HEALS Act, has $105 billion for education. That is important, and we can debate other things, and the Senate has a 60-vote threshold, but there's no way that Republicans and Democrats can't at least agree on supporting our children's education here in a few weeks, and at least pass that bill, and we can keep talking about others. But we need to get that through as fast as possible, because there's a deadline. Schools are opening. So I'm proud to stand with President Trump and my West Virginia colleagues working towards safely reopening the schools. Ultimately, these decisions are made by your local jurisdictions and even your parents. You have the online option as well. So I'm just glad to be here today, and thank you, Governor, for inviting us.
Thank you guys so much for being here. It's an honor to have you, that's for sure. But, well, I mean, if I could just go ahead and start, you know, like I said, today is the 19th of August. You know, again, I don't know how to do this anyway other than to just say we've now lost another 6 great West Virginians. I don't want them ever to become just a statistic. We talk about that all the time. We will also see that we've lost our 161st death, or 61st death rather, is a 90-year-old male from Logan County. Our 162nd is an 80-year-old male from Raleigh County. 163rd is a 74-year-old male from Raleigh County. 164th is an 86-year-old male from Kanawha County. 165th is a 75-year-old female from Cabell County. And our 166th death in West Virginia is a 69-year-old female from Kanawha County. Now, I say it all the time, but I mean it from the very bottom of my heart. You know, the days are great when you come in here and you don't have any deaths to report and everything. a day that you've got 6 deaths to report out of 166 is terrible. And some way, somehow, this has got to stop, and we've got to get by and through this. But you can see by the age of these people, I don't know that the average age was probably somewhere in the mid-70s or high 70s. You know, this terrible killer attacks the weakest, our oldest, you know, the people that have given us so much wisdom. And so we need to do everything in our power to try to protect them. Every possible thing we can, because this is the target of this disease. Now, it can attack the very young, but at the same time, that is minuscule compared to what it does to our elderly. As far as the numbers of West Virginia, they continue to be really, really good. You know, our numbers, you know, yesterday we had 81 new positive cases and a positivity rate for the day of 2.14. Our active cases now have dropped from 1,941 on Wednesday down to 1,726. That's a big move. Our hospitalizations have dropped, you know, from 134 only to 133. But the numbers, you know, now get this. Our RT number for our state right now is 0.91. Now, we were like at 0.995 or 96 and everything. Then we went back to 0.99, I think, on Monday. But now we're back to 0.91. That's the 9th best number there is in the nation. And so all that from a number standpoint is outstanding. But from a standpoint of just thinking of these people, please keep them in your thoughts and prayers. They're people with names and loved ones and absolutely have given so much to West Virginia. Please keep them in your thoughts and prayers. One other thing I want to report is we're working on a tweak on our metric in regard to our smaller counties. We're going, you know, we found, you know, and we listen to everyone. And so as we listen and as we look, you know, on our color coding to our counties of our green, yellow, orange, and red, we have looked and from the standpoint of our smaller counties, this can be skewed just a little bit, and we're trying to figure out a way to, in fact, we've got a way, I don't want to report it today, but I'll probably report it on Friday of how we're going to tweak that just a little bit, and it's going to be really beneficial to our smaller counties. Now, from the standpoint of Senator Capito and speaking of the stimulus package and Congressman Mooney, you know, talking about, you know, all the dollars that could flow in that package to our schools, you know, $105 billion. I have no clue on earth, you know, what you go through. I see it on TV and I think, my gracious goodness alive, I don't know how you can handle it, you know, but, you know, because there's just craziness going on a lot of times. And from the standpoint of playing, you know, with our kids and holding them in the balance, you know, of what, you know, and holding up these dollars and everything, I hope to goodness that the Nancy Pelosi lovers and everything in the world will come to some good sense and everything. We'll be able to get across the finish line. But again, I thank you for all you're doing, and I hope and pray we'll get across the finish line and get across real soon. You know, from our long-term care facilities, we now have 26 outbreaks in our long-term care facilities, and we're watching all the nursing homes naturally very closely, but especially these, and I want to read them to you. Grant County, Grant Rehab and Care Center, the Cedar Ridge Center in Kanawha County, the Trinity Healthcare in Logan County, Princeton Healthcare Center in Mercer County, the Pine Lodge Nursing Home in Raleigh County, and the Rosewood Nursing Home in Taylor County. Okay, so from the standpoint of our West Virginia churches, we have 3 outbreaks reported in churches now in 3 counties in Cabell, Taylor, and Wood County. And like I've said over and over and over, don't want to be a broken record, but for crying out loud, we go to church, we go with a mask on, we go with a pew in between us, we go with the social distancing. You're doing a lot better in the church areas and everything. And we're on top of this nursing home stuff. And like I said, the National Guard has been unbelievable. All the stuff that DHHR and all the people that are at the nursing homes have been just great. We've got to be super, super careful about going out of state and bringing this stuff back to us. So staff members, you got to be on guard. You really, really have got to know that if you bring this back into a nursing home, really and truly, we have almost instant deaths because these people are so vulnerable, and we've got to really, really protect them. So really watch what you do there, especially about going out of state. You know, West Virginia's unemployment rate, you know, at one point in time hit a level of 4.7%, and then we climbed to 15.9% in April, and today, you know, we're all the way back down to 9.9. You know, we recovered 47,000 jobs. You know, all that's good. You know, the national unemployment rate is 10.2. We're a little bit below that. We just want to keep trying to get better and better. As far as the Mon County bars, I want to just say this, you know, and it's not like I'm just stringing people along. We're going to have to extend the closing of those bars for another 7 days, but now we're going to tell you for sure that we're going to reopen unless we just get some terrible thing that happens in Mon County. We're going to reopen on the 31st of the month and everything. That's 7 days away. We're going to reopen in a 21 and over on an over status. We're not going to have dance floors. We're not going to have live entertainment, and we're going to expand the ability to go outdoors. And so, you know, I hate it like crazy. I know this is your business, and I know that's part of your life and everything. And but at the same time, we've got a situation where we've got to try in every way to protect everybody in that county and throughout all across West Virginia. So with all that being said, let me just keep moving and say, you know, from our small businesses, we now have out or awarded $9.5 million. It's 2,300 applicants. We need more applicants. I mean, for crying out loud, we thought there was 32,000 potential applicants. We need more applicants and everything to be able to, you know, get that out the door and everything. Get our monies out the door. From the standpoint of our sole proprietors, we dropped down a level and we tried to figure out, well, what can we do to someone that does not have an employee? They're a sole proprietor and they gain their wage from their profits and everything. Well, we figured a way to do that, and I am announcing today that we are opening the Small Business Grants Program to sole proprietorships and self-employed persons in West Virginia. But we're going to do it at a level of 2,000 till we see how many applicants we have and how many dollars we have to be able to get out the door and everything. May very well raise that up later, but you know, this is for people that do not have an employee. This is not for the people that have 1 to 35 employees. The 1 to 35 employees will still receive the $5,000, but from 0 employees, we're going to send 2,000 to everybody if we can just get your applications in, and we're going to be open today, as I understand it, on that. We've now got out the door $82,500,000 and change to 169 cities and counties. We want you to continue to apply. We just continue to send the money out as we can get you through the guidelines and we can get you approved, you know, that everything's taken care of from the standpoint of the guidelines we've got to go by. From our free testing stuff, you know, today we'll be in Lincoln County. We're trying to target our minorities as we have, because we know that the minority, you know, situation can skew negatively towards the minorities. We want more and more information. The more we test, the more we learn and everything. We're going to be in Lincoln County today, but anybody that has any anxiety level or if you have symptoms or don't have symptoms and you want to get tested, get out there in Lincoln County and get tested today. This weekend we'll be in Hancock County. Next week we'll be in Boone, Lincoln, Mason, and Webster counties. Naturally, it's free testing. It doesn't cost you a dime. It doesn't hurt. It's painless. For crying out loud. And like I said, the more we learn, the better we'll be able to help. From a standpoint of our summer feeding program and everything, there's been some confusion about that and everything. You know, I talk about how the dollars are flowing and all that in regard to our summer feeding program, and those dollars are primarily coming. You remember I've said over and over, we got 2 giant buckets of money here. And the giant buckets of money, we got CARES money and we got the grants money. And primarily the dollars that have been flowing from the standpoint of our feeding program and everything have come from our grants and come through our ag department. So that's all good. Now, from the standpoint of our census, and I'm sure that Senator Capito and Congressman Moody would tell you, we got to get counted in West Virginia. That's all there is to it. We're still behind, and I think we've moved that date up, to where really and truly, I think it's September the 30th. Is that correct and everything? And so if we move the date up, we got to hurry up and get counted. I mean, because it's just more dollars that can flow into our state, and it's really, really important. Last thing, but surely not least, that I want to say is we had a visit today from an incredibly important person within our nation. Dr. Burks is you see her on TV all the time. She is amazing. She is absolutely stuck on. She has incredible energies, unbelievable knowledge and everything. She's traveled all across this country and really, has probably driven in the last few days in excess of 5,000 miles. It is amazing, the work that she's doing and the great work and her dedication to West Virginia and dedication to this nation. I can very proudly say that she was tickled to death with the things that we're doing in West Virginia, especially our color coding, and she was really, really interested in that. Naturally, we were really proud to be the first state to be back in the green, and it's just, West Virginia, I say to you so many times, and I say this to all of us, from the standpoint of Senator Capito and Congressman Mooney and Dr. Marsh and Superintendent, Birch, myself, all the different people that work on this in every way, we're no better than the players. Absolutely, we're no better than the team. And you're the team. In West Virginia, absolutely, with Dr. Birch, with anybody in the world, you have still got to do it. And you've done it, and you've done it, and you've done it again. Our cumulative rate today is at 2.38. Our daily rate's at 2.14. We've tested well over 20% of our total population. We've tested 369,546 people. It's amazing. It's off the chart amazing. And absolutely, we owe gratitude in a lot of places. But at the end of the day, a tremendous amount of gratitude lies right with our National Guard. What a job they've done. It's unbelievable in every way. And the last of my last would just say this, Jordan, if you could pull up our recovered versus our active cases just 1 second. You can see we're widening even more. In fact, we dipped way down in our active cases right there. That's probably the best day that we've had for a long, long, long time. And that's absolutely what we want to do, and just keep it going, West Virginia. We're going to get there. Keep all these people in your thoughts and prayers. And thank you so much.
All right, thank you, Governor. Let's now go to Clayton Birch, our State Superintendent of Schools.
Thank you very much. I'll make my remarks today very brief. I will echo the Governor, Senator Capito, Congressman Mooney. We enjoyed our visit from Dr. Birx today. We knew that we had put a lot of time and effort into coming up with a Keller system, and we said from the beginning we would not allow schools to open if it wasn't safe. And I believe she was very impressed of the amount of care that we took not only in the metrics and the system to inform our schools, but also, one of the things that was important for us today was to hear from an actual superintendent, principals, teachers about their preparedness. And it was very impressive of how much time and energy has gone in, and they're all targeting this September 8th date. And I can't thank our guests here enough of the focus we're putting on making sure each and every one of those districts are ready for the opening of school. So with that being said, I also want to say that I continue to thank the 60,000 West Virginians who reached out and completed our survey. We really wanted our district leaders and our schools to be prepared for those options that they were giving for virtual and in person. The latest numbers were reported through last night from all 55 districts. It looks like I was going to say 75%, but I've been corrected. My math is wrong. It is 79% of the children out of 265,000 have signed up for in-person instruction. And I think that sends a message that we are ready for our children to be back to school, but it also now puts our schools in a position of implementing those plans. They're very, very different. We've gotten a lot of folks who have asked us about where to go. They're now all posted on the website. Those plans are really, really important. Each one of those principals and superintendents and county boards have put together a plan that best meets their community needs, and I cannot thank them enough. We want them to continue implementing them, and the plan forward, I just can't thank our partners. I know that we're going to hear from Dr. Marsh and others, but the ability to put resources and protocols in place has helped our teachers, our service personnel, and our schools tremendously. So thank you.
All right, thank you, Superintendent. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good afternoon. It's such a privilege to be up here with these great leaders for the state of West Virginia, and certainly through the governor's leadership. Just two comments. One is that Dr. Birx, who does lead the medical side of the White House Coronavirus Task Force, was both very complimentary of the great work we're doing in West Virginia, but also was very much a thoughtful person in that although we're doing well, we need to continue to pay a lot of attention to what's going on. As we start to repatriate schools and think about higher education as well with universities, we see around the country that universities are failing after their initial week of classes, including University of North Carolina, Chapel Hill, including University of Notre Dame, Michigan State, and others. And I think that the key is that we really have to underscore to our students, and this is true at the university level, at the high school level, at the middle school level, at the elementary school level, that the ability to maintain our schools is directly related to our ability to control COVID-19 exchange in our communities. So this is really about how we behave and how we respond. And West Virginia has been so good so far, but this is really where this is going to get even more challenging for all of us. And although our numbers are really good and we're really proud of where we've been, I think that it is really this time that people need to pay particular attention to wearing your mask and staying physically distanced and washing your hands, staying in when you are ill. The other thing I wanted to say is that our RT level, which is that reproductive score, has moved in the right direction. And that is really, really exciting. But remember, this measure is a leading and sometimes a lagging measure of where we are with cases and with hospitalizations. So as we are repatriating with our schools and K through 12 and higher ed, we will be watching that level really closely, because if that starts to inch up again, then that will tell us that our risk of having more cases and more problems really does exist in the future. So West Virginia, as we all work together to be able to get back in schools and open up our sports and do the things that we love to do together as mountaineers, it's really, really important for us to be extra careful, extra cautious, and extra committed to those mitigation measures that protect ourselves, protect each other, and protect the good state of West Virginia. So thank you.
Thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. National Guard continues to work a number of testing missions as well as disinfection, sanitization missions. I'd like to take a point of privilege today. Today at 10 o'clock in Tornado, West Virginia, a bridge was dedicated to Master Sergeant retired Dick Smoot, a long-time member of the West Virginia National Guard. Dick was a Vietnam veteran as a young man. Later in life, went back into the military, joined the National Guard, became Special Forces qualified, multiple deployments overseas in Iraq, Afghanistan, to include one of a group of the first Special Forces soldiers in Afghanistan after 9/11. served a great career, was a great mentor to a lot of folks, and unfortunately later in life was killed by a drunk driver. Dick was an inspiration, a guy who at 50 years of age went back to scuba school and was just a tremendous asset to our nation and our state. I want to send out our love and respect to his family on the day of this bridge dedication. Thank you.
Thank you, General. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. Just want to make a quick announcement and correction with regard to data on our dashboard. Yesterday, we made a human error with regard to an entry and showed 18 deaths for Trinity Nursing Home in Logan County. That was incorrect. There were no deaths yesterday. That should have been 0. I apologize to the facility and to the administrator and also to the citizens of the community. We strive to try to make this error-free, but as I've said before, the amount of data we have coming in certainly makes it prone to errors. But I want to again apologize. We want to make sure that certainly deaths are accurate. There was unfortunately a death at Trinity that is now at 10 o'clock on the new dashboard. It does show as 1, so that's correct. In case there are questions there. Our regrets go out to that family. We will do our best to try to make that dashboard as accurate as possible. Again, if it's an error, we will provide updates and corrections when it's an error and notify folks of that. So with that, we will turn it back to you. And thank you.
Thank you both. We'll now go to questions from members of the media. The first today is from Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. Governor or anybody, obviously you've talked a lot about the Burke's visitation earlier today, but I was kind of hoping we could get some a little bit more elaboration on what specifically was talked about and what her remarks were for how we're doing across the board. I know obviously you said some of this, but I was kind of hoping you could drill down a little bit more into the details of the visit. Thank you.
Well, let me lead off, guys, and then anybody can jump in and talk as well. But Stephen, the one thing that I really struggle with is just this. I love it when she is saying, just how good West Virginia is doing, but at the same time, I'm self-conscious from the standpoint that, if I come in here and say, oh, she said we're great, we're just beyond belief great and everything else, it's like, that just seems a little arrogant, and so that's why I didn't drill down. I'll let other people drill down. The one thing she said was this. She said, as she goes and meets privately with people, as we did, and everything, from the standpoint of how we're doing and warning us about things and telling us we should do this and that and everything else, she says she's not very positive. She's a colonel, too, and she can be tough. I'll promise you that. But she was absolutely just very, very pleased with West Virginia, to say the least, and pleased about our ability to innovate and create our own PPE, to doing all the stuff from the color coding of how we're going to go back and how we're treating our counties and everything, to our numbers that we already have. But it was a really great visit. I don't want to sit back and just blow our chest up and everything and just say how great West Virginia is, but I know how great West Virginia is, but it's not us doing it, it's the people. But I'll pass to Dr. Marsh, then I'll go back to our congressional leaders here.
Well, Stephen, thank you. The governor is exactly right. What Dr. Burke said was that we are a green state related to our profile, which is the first one she's come to in a while. she was very impressed with our collaboration, our innovation. You know, she also understands that there's no absolute playbook for this. This is a generational event, and that having a team that can adapt very quickly, that is agile, is learning as we go, is sharing best practices, working together, are real hallmarks of success. So she also understands that we are not finished with this event and that this is much different than anything we've seen before. So she was appropriately cautious, but she did feel like that we were doing many of the right things and in fact wanted to share some of the practices that we have engaged in and some of our creativity with other states and other governors.
Yeah, I just add to that, Stephen, this is Shelley Moore Capito, that she was particularly interested in the color coding system for the reopening of the schools. She recommended that it's going to be part of her governor's report, that where they share best practices with all the other governors around the state, and she warned the governor that he might get 49 other governors calling him to find out. The other thing I asked about, and I was interested to hear other people were interested in, is the vaccine development. Obviously in Washington, I sit on the Appropriations Committee. We've put a lot of money into vaccine development, and there are 6, I guess, active vaccine developments. She expressed cautious optimism that a vaccine would be developed in a timely amount of time. She didn't get specific at all, but it jived with what I'd been hearing in Washington from the heads of NIH and CDC. And I think it's going to be one of those facets of ending this that we're all anxious about. And so I was encouraged to hear from her national perspective what she's seeing in terms of vaccine development. And she emphasized the same thing I emphasized in my opening comments, is the importance of communication. And I can tell you she is a wonderful communicator because she includes in her communications a lot of talking about students, moms, dads, teachers. She sees the whole parameters, that she has a global experience of dealing with pandemics, and it really showed today. So not only was she complimentary about our state, I think she brought a national and international perspective to where she sees this whole thing in perspective for a lot of us.
So, Stephen, this is Alex Mooney, West Virginia 2nd District. What I took away was, while things are getting better, we're still not quite out of the woods yet. We still need to take precautions. Individuals in our state still have to avoid social gatherings, which would give an opportunity for super spreaders to create another bigger problem, which would maybe require closing of a school. At the same time, she does think we can be safe and go back to school, have that choice to go back to school if you want, or choose the online learning, and that it's important to do that in a safe way, but have that option. So I think she represents the president really well, which is why he's chosen her to be in charge and send her around to different states. She also mentioned she's not afraid to call out a state or a community that's not doing the right thing, and it was public. She called out the state of Georgia when they weren't doing things that she thought was right. And so on the flip side of that, she was happy that we have been taking the precautions here and seem to be doing better.
All right, thank you, Steve. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hello, Governor, Senator, Congressman, everybody. West Virginia has, as Governor Justice has mentioned many times, an aging, vulnerable population, and many of those voters, as they did in the spring, may opt for absentee ballots this fall, particularly from the congressional delegation, but from the governor too. What assurances can you provide that the U.S. Postal Service will be able to process those ballots this fall? Thank you.
Well, I think that's obviously a huge topic of discussion. I think that the Postal Service did receive a $10 billion loan to ramp up their systems. We put a lot of money into election security. We put a lot of money into helping states, like our Secretary of State, Mac Warner, be able, when you saw what he did in the primary, where he was able to spend some money to make sure ballots were mailed to the people that wanted to vote remotely, he couldn't say, I can't afford it or we can't get it done. So we've put a lot of money into that aspect. What I would say is I have faith that the postal system will and can deliver our ballots on time, safely, and so that our elections will be secure and counted in the proper time frame on Election Day. But I would say to the people of West Virginia, and I don't know if the governor, we haven't really talked about this, but for those of you who want to vote remotely, the Secretary of State has set up a website so that you can get your ballot, and that the encouragement is to do it as soon as you possibly can. That would be my recommendation. But I have faith, and I'm sorry that we've got this controversy with the post office, quite frankly. But I think that we're on the way to smoothing it out and hopefully regain the faith that our ballots will get there on time, safely, and be counted on the proper manner.
And I would just add, this is Alex Mooney here, in addition to what Senator said, the head of the post office did announce that all the changes that people were criticizing are going to be held till after the election anyway. President Trump was simply trying to make the government work more efficient. These changes have been discussed for a long time, but they put them on hold. So there's a lot of misunderstanding, misinterpretation, I think intentionally to attack the president. But it's all on hold anyway. You can vote by mail if you want. But I should also point out that Dr. Fauci recently announced that it's safe to vote in person. I did vote by mail in the primary. I intend to vote in person in November. As long as you maintain social distancing and take the precautions, voting in person is still the most secure, efficient way to do it. But you can vote by mail. There's going to be no problems if you choose to do that.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor or Dr. Marsh or Superintendent Birch, I know that you've given parents the option of whether they send their kids to school or do virtual learning. The reality is a lot of parents don't have an option. They don't have workable childcare. They don't have a plan or anyone to take care of their children while they have to go to jobs themselves. So school is their space of last resort when they plan for a fall semester to be starting. That being said, with some parents sending their children to school, they're still unsure about safety and spacing and all the concerns you've talked about. The bottom line is I'm getting a lot of questions from people who are uncertain about the testing procedures. If one person tests positive in a class, does that entire class get tested? Are they all put under a 14-day quarantine? How is mass testing or specific singular testing going to be handled in schools when the inevitable outbreak occurs somewhere, as we've seen what's happening on college campuses and at K through 12s throughout the nation? Thank you.
Let me lead off, okay, and then I'll pass to you guys as far as how we're going to do the testing, how we're going to do the quarantining, what we're going to do there. But let me just say this, Kenny, we do have a choice, from the standpoint of our parents, and here's the choice, and it's a little bit different than what you may expect, and it's just this: if we had a situation to where we believed. We, the people, the leaders, believed that things were not safe and that we were exposing our children, our teachers, our service personnel too much. We do have a choice, and we would exercise that choice, and we would say, we can't go back. That's all there is to it. We do have a choice from our parents' standpoint. I know many of them don't have the ability to have daycare, and they have all kinds of issues and everything. However, if it were absolutely dangerous or exposing too much, those parents would make a choice that some way, somehow, we've got to keep the kids at home and go virtual. But the other thing that we do have a choice about is just this. Because our parents have got to go to work, and because our parents don't have daycare, and because of that, we need, beyond all the goodness that it brings to our kids, we need to make the choice to go back to school. That's absolutely it. It's driven by so many things. It's all the needs of our children, all the needs of all of us, all the needs of the economics, all the needs of our parents, we do have a choice. And that choice today should absolutely be to try in every way we possibly can to safely go back to school. And so with all that, I just say just this, now our children and our parents, by the numbers that Superintendent Birch has, of 79% of the people, basically, of the kids, are saying, we're coming back to in school. Now, if that be the case, what are they doing? They're basically saying, we entrust you to have the place safe. We entrust our superintendents to be doing the right thing. We entrust our governor and our senators and our congressmen and all the medical team to have it right as best we possibly can. And you can bet your soul with all in you that I would not approve or not be in favor in any way of going back if I didn't feel with all in me that we were doing the best and it was the safest that we could possibly make it. So I'll pass on to Dr. Marsh and Superintendent Birch, but I believe we have a choice, and the choice is the right choice for all the different reasons that I've said, and that's get back in school.
Kenny, just real quick, I just want to thank Dr. Amjad is actually working with us hand in hand. Secretary Crouch, Dr. Marsh, they've made a lot of their folks available to us. One of the things the county superintendents have asked for is that protocol, because if there is a suspected case in a classroom, they want to know exactly, working with their local health departments, what are the appropriate protocols to keep everyone safe from a quarantine or a deep cleaning. But again, Dr. Amjad and Secretary Crouch and Dr. Marsh have been working with us, and as we wrap that up, we actually hope that will be posted soon, but I think Dr. Marsh might have a little more insight into protocols.
I'll just start off, and Ein, if you have any other comments, or Bill. So in general, Kenny, what would happen is it would depend on who would be infected with the COVID virus, who they came into contact with. We're really trying to segregate or cohort the kids and maintain the sort of the separateness between the classes so you don't get the intermixing. When New York City went underwater, they had so many people interacting with so many other people, you couldn't even track who may be infected. So in general, what we would probably do, if it was in a room and that room had been appropriately sort of separated, then we would tell the people in that room, we would remove the child or the teacher from that room. We would likely tell that room to quarantine and then notify the local health department. They would then start to do their investigation, and if they found that there was not significant interaction, which is defined by 15 minutes of exposure, 6 feet or less apart from the other person, then they would release those people from the quarantine. And so this is an approach that Superintendent Birch has said. It's a CDC approach, and we certainly will post this, but this is sort of the standard. And what we'll do is we'll isolate the people that might have had a risk to begin with to protect anybody else. And then we'll get more precise on, among those people, who are the people that really do need to be separated, isolated, and some of those people may be referred to getting COVID tested to see if there's any spread, but that's generally the approach. I don't know if you have any other comments, or Bill.
Sure. Kenny, we are working to finalize, basically it's an outbreak guidance report. And we've shortened it from, I believe, 15 pages to 12 pages, and I believe we're down to 5 or 6, and we actually have a meeting tonight to finalize it. But it is a step-by-step guidance to answer those questions for local counties of how to deal with if a child is suspected to be sick or have COVID-19 in the school, so that a teacher or a principal can know what to do step by step with pretty much what Clay just stated. And you would be working with your local health department. So that will come out. We're trying to finalize it and make it as clear as possible of what to do, but you work hand in hand with the local health department, and that is coming out And we do understand that there's a lot of people with COVID fatigue. This has been going on for probably over 160 days, but we want people to remain diligent about wearing a mask, social distancing, because this is in the best interest of kids who want to go back to school. As Clayton Birch mentioned, it's about 79% of kids who want to go back to school play sports. It's in their mental health interest to go back for everyone. And I believe Governor Justice mentioned it earlier this week, hospitals, we made it safe for patients to go to a hospital. Schools should also be in that realm where schools should be very safe for children to go back. And we should be working on that model for it to be a safe place for children to go back. So we are working on that, and that should be going up online as soon as possible. We're trying to make it shortened and easy to follow, that it's easy to for everyone to go through, because we know people want to see that right away. But we have a meeting to finalize that tonight, actually. Thank you.
All right, thank you, Kenny. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. We reported some cases last night at West Virginia State. We know there are cases at WVU. Marshall students are back. My question for you is, are K through 12 students going to be at a disadvantage in the counties where those universities are, because we have the college population, and what can be done to help send that message on college campuses that it's not just about them being in class, but also, the younger people in the county?
You guys are going to have to answer this one.
Yeah, that's a really important question, Amanda. And I think that what we see, and this is true for the entire state, this is what Dr. Birx talked with us about and what we presented to her, this is really a team effort that, to keep the schools in, to be able to open all the schools, to be able to keep the universities in, to be able to open the universities, it's going to require us to control the rate of spread of COVID-19 in those communities, in those counties, and eventually in our state. So as we have talked about the gating strategy, which is to maintain a less than 5% case positivity rate over a 7-day rolling average period, that means for the whole state. So it's all of us that need to work together to be able to open schools and keep them open. But you're right, if universities and high schools and middle schools and elementary schools are part of the same county, they are all responsible then to each other to maintain those metrics so that everybody can stay in school.
All right, thank you, Amanda. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, on Friday and then over the weekend, you said you were considering imposing some kind of travel restrictions, some kind of mandatory quarantine period, particularly related to Myrtle Beach. Is that something that's still being considered? Is that still on the table?
Charles, I'm glad you asked, because in my notes here, I want to talk about Logan County just a second, and that's primarily the county that we had an outbreak the same way in Preston County and different places, where we had people traveling to Myrtle Beach. What we're seeing is the numbers slightly move in the direction to where they're moving the right way. And as they continue to move the right way and everything, then we're still holding the reins on going there. But I want to just say this in regard to Logan County. I had a beautiful lady call me today. Her parents still live in Logan County. She grew up there, I think, and everything. Now she lives in Mason County. And we talked this morning on the phone. She was really, really afraid about the people that were coming into the Hatfields and McCoy Trail and the riders that were there and everything, and they were going in and out of stores, and oftentimes they were being lax about wearing their mask or whatever it may be. And all I would just say is just this: we don't have any evidence right now of anyone that has brought us this situation from a Hatfields and McCoy Trail visitor. However, I would just say to all those and all the establishments that are taking care of these people, whether they be lodging or they be, food or whatever it may be, I would just say just this: if they're going to come to our state, then they have to absolutely be respectful to all. And I would encourage them in every way to really tighten down on this, because we're going to have another problem. And that problem could come from just exactly what this lady was concerned about the most. But she was a beautiful lady and spoke so well to me. And I can tell you without any question, we need to respect her. So all those establishments that are out there and they're seeing people from the Hatfields and McCoy Trail, tighten it down. That's all there is to it. We got to tighten it down. And those people need to be just as respectful as I am to the lady that's got two 80-year-old parents that are living in Logan County and scared to death. Now, I know that we don't have the incidents coming from the trail, but I absolutely know right now that it can, and we need to tighten that down. But Charles, back to your thing, we're still holding as far as initiating more restrictions and travel restrictions and everything, but we're still watching, and we're watching really close. And if need be, that's what we'll do.
All right, thank you, Charles. Next to Haley Kosick with Nexstar Media. Haley, your mic is muted.
All right, now try it. I think we're good. All right. Hi, everyone. Happy to be joining you today. I want to bring back to secondary education, going off of Amanda Barron's question. Now, we've seen a lot of the COVID exchange not necessarily linked to dorm life at major universities such as Notre Dame, but more rather at parties and off-campus events. So with that being said, with move-in and WVU and a couple cases confirmed at West Virginia State, could we see any college activities being canceled or temporarily? What do we got going on with that?
Go.
So thank you for the question. Certainly, as we have started this phase of COVID-19 in West Virginia, what we've talked about for really the entire time is the necessity to go from something that's very general to something that's much more precise. And so as we looked at for instance, Mon County in the past, what we found was at the time that Mon County really had a substantial outbreak in cases among 20 to 29-year-olds, that we tracked those cases back to bars in Mon County, and the governor decided at that point too to issue the executive order for mask wearing, and the combination of mask wearing and that specific mitigation strategy in Mon County brought those cases down. And that's what we're really looking at. And as we just talked about, the issue about travel from places like Myrtle Beach or other places with high endemic activity of COVID-19. As we look at the universities and their responsibilities, then what we would say to them, and certainly we have great leadership of our universities and colleges in the state of West Virginia, but it really becomes incumbent upon the universities to hold the students accountable and to try to do the kind of things that reduce the risk of having students congregate in big unprotected areas like parties without masks. And we know that 18, 19, 20-year-olds are very full of enthusiasm for interacting with each other. And certainly as some alcohol might be consumed during these times, the judgment may tend to wane. But it is really on us to make that commitment as an honor code violation and as a personal responsibility, because if we aren't able to control that person-to-person spread, which is the way COVID-19 spreads, then like many other universities and colleges around our country, we may start and then have to stop and go back online. So I think that that is really the job of the universities and the students to do that, working in close collaboration with their communities, their counties, their county commissions, their local health departments, and we have great teams around the state to do this. But this is a very, very, very large challenge for us, and I think that we'll really understand how skillful our people are and how committed our people are to see how we can manage this next big challenge for West Virginia.
All right, thank you, Haley. Next to Ryan Quinn with the Charleston Gazette-Mail.
Hello. Why isn't anyone mandating masks in K-12 schools, particularly mandating that school employees and middle and high school students wear them? Your color-coded plan only strongly mandates masks at the orange level, but it seems all counties will see increased cases if schools don't require masks, like we've seen when Georgia hasn't been requiring them. And then regarding the coming adjustment for small counties, why is that needed, considering it's already population adjusted and it's already based on a 7-day rolling average?
Okay, the first part of this question, Ryan, I'm going to let Superintendent Birch answer. The second part of the question, let me just add this little bit to it before we get into it, and then Dr. Marsh is going to jump in and wrap that up. But yesterday, I received an email, or a text rather, and the text came from a good friend of mine up in Pleasants County. His name's Jay, and I'm not going to go into his last name, but Jay had a real concern about the metric that we were using as it reflected to the smaller counties. Now, that's all he said, but that's all somebody's got to say to me, and I'm going to go back and double check it. So I went back and we started through the math, and we called everybody together yesterday evening, and we started checking, and lo and behold, we do have a bias. Even though we're moving it and adjusting it with population, it does show a skew or a little level of bias. And so it was a good tip. And we went right back. We went right through the math. Dr. Marshall will explain that to you a little bit better, but Superintendent Birch will answer the first part of the question.
Sure, and I'll also ask Dr. Marsh if he wants to chime in. We've been having a conversation. So for 3 months, the plan's been being put together. Prior to us having the Kellers, we talked about mask wearing on buses, non-congregate areas. We talked about masks when they could not social distance, especially we were concerned with our grades 6 through 12. And so, yes, now that you see the color coding map, we're going to actually revisit that and have a discussion. We've asked DHHR and Dr. Marsh to have a discussion with us about what that could mean to as part of a mitigation as you increase colors. And there we absolutely will be looking at additional requirements for mask wearing.
And I would just say very briefly, because we have not finalized this meeting, that we are very committed to adhering to the highest standards, CDC guidelines and others, that make recommendations to make the classrooms as safe as possible for all involved. So more to follow on that. When it comes to the reason why we're revisiting a little bit, or not really revisiting, but we're really tweaking a little bit the color coding, that we know that West Virginia is a state that's made up of some very, very low population counties. And when we have very few cases that could happen over a 7-day period of time with a 7-day rolling average that could put a county into the orange, we want to make sure that that's not just a sort of a happenstance, a kind of a outlier event, and want to make sure that that's a consistent, level of community spread. So we will be coming out with additional guidance, and we'll work with the governor and all of our public health people. But we believe this system is good. But for counties that are very low population, this has never been validated. And the problem you have, because you have to do the mathematical adjustment to get to 100,000 population, that in some very small population counties like 5,000, you're using a pretty heavy sort of multiplication effect to get it up to 100,000. And we believe that there's a better way to provide for consistency for those small counties. So not a huge tweak, but a little one that we think is going to make this an even better model.
All right, thank you, Ryan. Governor, I'll turn it back to you.
Okay, I'll go quickly here and everything. I want to make sure something we've cleaned up. I try to make the notes as we go forward and everything, but the bar reopening in Monongalia County is August the 31st. That is 11 days away and everything, but that's what we're going to do. Now, as far as the rules and everything on how we're going to reopen. We're going to come out, I think, today with those rules in Mon County. And I've got just a couple other things real quickly. You know, Sarah Tucker was in the meeting today with Dr. Birch and you know, made one statement that was really good. You know, along the way, it was recommended to us that we test only the out-of-state people that are coming back to our universities and colleges, and through the National Guard and DHHR and all the local health people and everybody that's jumping in and doing stuff. We said, no, we're not going to do that. We're going to test everybody. Well, lo and behold, what we found was we found a lot of the positive cases that we're finding are from the people that are in state. And so that was a really good find and everything that we can help that. But the good part about it is we have less than 1% of the population that we've tested that have tested positive of all the people that are coming back. You know, I talked with Dr. Anderson down at Appalachian Bible. I think they tested everybody and they came up with zero positives. And so that was really good. The last thing I want to tell you is just this, and I promised a fellow, you know, his first name is Michael. He was at the Rodale Volunteer Fire Department. I promised him the news would come today. And so Michael, listen to this. All the monies for all the volunteer fire departments are teed up, and electronically they will go out today or possibly tomorrow, but they will be going out immediately. They're teed up, they're ready to go. They're going to go out right now, and I think that's 400 and some odd fire departments that help us in every way. I think it's 419. And with all that being said, you know, that's $10,000 coming to each and every one of them, and that's good. That'll help them. He needed it at his volunteer fire department in Rodale, and he needed it from the standpoint of buying equipment and everything, and I think that's great. It'll just save more lives. And the last thing I've got to report is just this. There'll be dollars that will be the same amount of dollars. The 10,000 will be, it's beginning to get teed up to go to our EMS people and, you know, and all the great work that they do. So that'll be coming out, and it'll be coming out real soon. But that's all I've got, and I'm hustling along here and everything. But nevertheless, again, I thank Senator Capito, Congressman Mooney. Thank you so much for coming and everything. No, it's really great and everything. So I thank everybody. We're moving in the right way. Thank you. God bless each and every one of you.